Hello, this is Dr. Wells with Wells Medicine, and I wanted to discuss the concept today of pain as a fire alarm. A lot of patients come to my clinic, and when they start working with me, often they will have sort of very sharp, very pokey touch points of things that are very, very painful for them. Maybe it's family life, maybe it's their past history, maybe it's a trauma, maybe it's their job, maybe it's work-life balance or their um, politics, but they will have certain touch points. They're very, very painful and sharp, and lots of thoughts that sort of surround those touch points that increase their suffering for those painful elements in their life. And usually, when I talk about ketamine treatment and when we talk about therapy, in general, I'm trying to have the discussion with patients about changing their perspectives, working with their thoughts, finding thoughts that are equally true but less painful, finding thoughts that are equally true but also helpful, finding thoughts that sort of diffuse the situation, finding thoughts that allow them to accept the situation. And patients have commented to me in the past, like, this is just an unacceptable situation, or this is just too painful, or uh, you know, do I have to live with this situation forever? And one thing that I really do want to point out is sometimes in life, pain is a fire alarm that should not be ignored, whether it's mental or physical pain. So, for example, if I have a patient that has really, really horrible stomach pain, and they come to me in the emergency room, I don't just want to immediately diagnose them with anxiety and depression and functional abdominal pain and say that this is just a chronic pain they're going to have to live with forever. Obviously, when someone comes in with really, really severe abdominal pain, you want to do the workup and make sure it's not something like appendicitis or a perforated bowel or gallbladder disease. Similarly, when someone comes to me with something very, very sharp, very pokey, very traumatic, very painful for them emotionally, it's not something that I want to just say is that's depression, that's anxiety. You're just going to have to live with that for the rest of your life. Let's find ways to change your perspective on it and find ways to be more helpful and true. Sometimes the pain is a fire alarm telling you there may be something in your life that needs to be changed. There may be something about your life that is ill. Not that your brain is ill for creating this pain. People feeling pain are not, creating that abdominal pain. There's something there that needs to be fixed. Sometimes in emotional pain, it can be a chemical problem. Sometimes it's a problem that can be fixed with the perspective change that ketamine brings, or the problem can be fixed with a decrease in the sympathetic nervous system, like a stellate ganglion block. But sometimes it's a problem in our lives that maybe we're not ready to face yet, or maybe we're not ready to do something about yet, like a work-life balance situation, or an abusive relationship, or alcohol and drug problems, or dealing with and moving through the grief of losing a loved one, or the grief of losing a future that we had planned, or the grief of finally accepting someone for who they are and not who we want them to be. And those are all very, very difficult things, very painful, emotional things to do. And we're not always ready to face them. But I would argue those things aren't that your brain is necessarily broken, but rather that there are just some incredibly painful things in life that cause us to sit up and take notice. And just like a fire alarm, we need to do something about them. When a fire alarm is going off, we can take out the batteries and get the fire alarm to stop. Um, but sometimes there's actually a fire there and we need to deal with the fire. So that's kind of what I'd like you to consider. Is this pain, emotional pain, physical pain, is it a fire alarm going off? And, is it something that at this time it's more appropriate to remove the batteries, change medicines, add some ketamine, add TMS, add stellate ganglion, or is this something where there's really a fire there and it's time to put out the fire?